Hi, I'm Dr. Trinidad Rodriguez, family physician from the Catholic University in Santiago, Chile. I hold an academic position here and also work at the Health Innovation Center, where we design, implement, and evaluate innovative healthcare models in order to contribute to the resolution of gaps and problems in the public health system that are important for the general population and the country. In 2020, I was asked to develop a training program for primary care health workers that would be implementing a new strategy of care for infants, children, and adolescents. This was very challenging, as I would have to develop a capacity building initiative for people with different backgrounds, knowledge, and skills. So I formulated this research question. What characteristics should this initiative have in terms of teaching methodologies, assessments, and evaluation? I began working with my team and also with the advice of members of the Best Rower Center, with whom we defined objectives and built a Gantt chart. But then the COVID pandemic came along and changed the whole scenario. At first, we began thinking about a bi-learning methodology for the program, but soon we realized that it would have to be delivered completely online. How could we transform a whole program that was thought to be taught in person to a completely online mode? How would we teach skills and abilities like communicational skills, motivational interviewing, tools for working with families, etc.? That's when my research question had to change. Now I would have to find experiences in distant education and online teaching. But more challenges were to come. A few months later, we were told by our partner that the implementation of the strategy would not take place in 2020, maybe in 2021. Also, we realized that training and implementation would come in a very difficult context. Exhausted and probably burned out healthcare workers and the health system pushed to the limit by the COVID pandemic. Later, work with our partners became more and more difficult. They had to focus mainly on reorganizing care because of the pandemic that was going on and didn't have time nor money to spend on a project that probably would not be implemented in the short term. In spite of that, we continued working on the whole project and decided that we would have it ready for implementation when the right time came. We also started thinking of evaluation, specifically in the construction of a baseline measurement, and started looking for other funding sources. The training program is ready now in its structure and main contents, but we are still waiting for the pandemic to be more under control so we can start thinking about delivering it. When the time comes, I think that this training program will have a great impact on the way primary care teams deliver care to infants, children, and adolescents and their families, providing them with different tools that will allow them to have a more comprehensive understanding of infant, children, and adolescent development, how to support their families during the process, and how to work with them to promote their well-being. What have I learned from all this experience? 3 words, I think: flexibility, adaptation, and creativity. I have learned, and I'm still learning, to manage uncertainty, just to assume it's there and to think out of the box to find creative solutions to the problems. I've understood that probably the times planned on my Gantt chart won't work as I thought they would, that there are certain things that we can't manage or even predict, and that we just need to adapt and do the best we can with what we have.